So today we're going to start a very important topic which is hairy tongue. So let's start it. Bismillahirrahmanirrahim. Okay. When the patient comes to you with such appearance, it is an when the appearance is also blackish. Okay, always remember. Okay, the patient can come to you with this appearance of tongue also. So very important. Okay. So basically, what happens, it is also called coated tongue or black hairy tongue. Okay, the coated tongue can also be yellowish in color and the black hairy tongue can be in black in color. Why it happens actually? What is the causative agent? Yeah, what is the pathology? Is basically the accumulation of the keratin on the filiform papilla. Yes, the filiform papilla is involved in this disease, you can say. Increase in keratin production or decrease in normal keratin discrimination. What happens that the normal keratin is basically accumulate in the filiform papilla, but the discrimination, yeah, wearing of the normal keratin is not happening. Okay, now what is the causes? Number one, it is unknown, but mostly it happens to the smokers, the patient who smokes a lot. Yeah, generally depletations mean they are generally weak. Yeah, poor oral hygiene some patients have. Radiation therapy, yeah, oxidizing mouthwashes and antibiotics. So what we have discussed now up till date, yeah, so basically we have said that the heavy smokers or generally weak patients, yeah, poor oral hygiene. Okay, then we say that the radiation therapy, oxidizing mouthwashes and systematic antibiotics. Okay. Okay, now normally what happens, the pathogenesis of hairy tongue. So listen very carefully. Normally what happens that the keratin basically deposit in the tongue papilla and the discrimination is happening. Discrimination is happening through the when the tongue touches the food or the rough surfaces of the palate or the upper interior teeth. So that discrimination happens basically, and there the new cells then arrive there from below. But when there is the lack of the tongue movements and the tongue is not touching the food, yeah, rough palate, yeah, upper interior teeth, very important thing. Okay, so what happens that due to any reason, either it can be local, can be systematic disease. So basically the regular discrimination process of the tongue papilla disturbs, especially the filiform papilla. So what happens, there is an lengthens or produce a hairy appearance on the tongue surface. What happens that there is a hairy or lengthens or hairy produce a hairy appearance on the tongue surface. Okay, like we have in this, the picture is not normal, but you can see there is like a lengthens and the hairy appearance of the tongue. Okay, due to the accumulation of keratin. So basically what happens, we can say there's a hypertrophied papilla. So hypertrophy has been occur in the papilla, are often coated with the microorganisms. Either it is due to microorganisms or become discolored by retaining the pigments. Either the microorganisms are involved in this process or either the pigments which come either from the food, medicines, chromogenic bacteria, etc. One of when people who are anemic or who have iron deficiency takes the iron, so the patient has the blackish type of appearance of the tongue. You can observe whenever you take the iron tablet, and you can see your tongue also. It is due to the pigments actually. Now, clinical features, it mostly affect the older age people, means 50 plus patients, 50 aged plus come to the doctor and with this complaint. Okay, it is either the midline of tongue interior to circumfallate papilla, sparing the lateral or interior borders. So what happens that this is the tongue, you can see it. Okay, so what happens, it does not appear the anterior or lateral borders, it is basically here, it is basically in the midline. Either it will be in the midline interior to circumfallate papilla, there is a circumvallate papilla. Okay, and basically leaving the lateral and interior borders. The elongated papilla are usually brown, yellow, black. They have three colors like brown, yellow. So what we have studied the pathogenesis. Basically, normally what happens, the keratin is deposited in the tongue papillas, and normally there's a discrimination process that occurs by when the tongue moves and it touches the food, hard or soft palate, or either it can be interior teeth. So there's a discrimination and the new cells come out, but due to the lack of movements, either systematic or local, any reasons, the discrimination process is not occurring. So what happens, there's an accumulation of keratin and it lengthens and produces a hairy like appearance on the tongue surface. Okay, and patient with the 50 plus age will come. They have tell you the location, that it is in the midline of tongue interior to circumvallate papilla and leaving the lateral and interior borders brown and yellow black in color. Basically, there is a multiple individual elongated filiform papilla may be isolated, also means there may be multiple, multiple individually and elongated, means there are many filiform papilla which are isolated. The patient is asymptomatic and gagging sensation or bad taste. The patient has a very gag or a bad taste in the mouth. Bad taste. Coated tongue. Now, numerous bacteria and discriminated epithelial cells accumulate on the dorsal on a dorsal tongue without hair-like filiform papilla, without hair and white appearance. So this basically, the coated tongue is usually yellow. You will see in color. Okay. So what happens? Either maybe bacteria, the discriminated epithelial cells accumulate in your dorsal tongue without hair-like filiform papilla. That does not have a hair hairy appearance. It is whitely appearance or yellow. You can see. Acha. Hairy leukoplakia. We have said that the hairy tongue, basically, if you say it is on the midline of tongue interior to circumvallate papilla, leaving the lateral interior borders, but hairy leukoplakia is on the lateral borders of tongue due to Epstein-Barr viruses or HIV or immunocompromised conditions. Okay. Now this is the hairy tongue. You can see it. Basically, this is another picture. This is the lateral view of the tongue. Now how will you diagnose? The patient came to you, either it will be clinically diagnosed or you will take biopsy. In that case, basically histopathological features basically have, so basically we have marked elongation and hyperparakeratosis, usually because there are keratin accumulation in the filiform papilla, numerous bacteria and moderate inflammatory infiltrate. So okay. Now it is a benign condition, asynthetic appearance. Basically the patient has a cosmetic problem, basically, or either a bad breath, or rather a bad taste. Patient has breath breath. Guidelines. Basically what you have to do, you have to remove the ethological factor. Either it can be patient having a very heavy smoker, bad oral hygiene, basically having radiation therapy, oxidizing agent, etc. Patient can have. So you have to remove that factors in. Okay. High level of oral hygiene you have to recommend. Patient should be reassured that the condition is benign. You have to tell the patient that relax, it is very normal, it is a benign condition, it can be treated very easily. Reassurance are very common. You have to, it's very common to tell the patient. In mild cases, what you do, brush the dorsal of tongue with a tongue cleaner every morning for 1 month or more, depending on any involvement improvement in the condition. So what you have to, you will, in mild cases, you will tell the patient that brush your dorsal of the tongue with a tongue cleaner for every morning for 1 month. You have to do, depending on any improvement in that condition. Ki the, or it also that depends ki, there will be improvement or not, but for 1 month you have to do at every morning to clean your dorsal of tongue. In severe cases, long filiform papilla, what you have to give, you have to give topical treatment. It is keratolytic agents such as 30 to 50% of trichloroacetic acid, yeah, salicylic acid in alcohol. Okay, so what you have to give to the patient topically, it is 30 to 50% of trichloroacetic acid or salicylic acid. You have to give in alcohol, or 40% urea, or 40% urea in the water destroys the elongated papilla and restores the tongue of. So they have tell you about the keratolytic agents, which is 30 to 40% trichloroacetic acid, okay, yes, salicylic acid and alcohol, or either you will give the patient 40% urea in the water, okay. So 30 to 50% trichloroacetic acid or salicylic acid and alcohol, or 40% urea in water to destroy this, okay. Trichloroacetic acid is the best and should be applied with care, okay. It can be reapplied in 1 week's time, and if there are remnants of the elongate papilla, you can reapply it also if you think there's a remnants of that papilla left, okay. So with this we have come to across the filiform the hairy tongue with this. If you have any question you can tell me.